Hello and welcome to the first lecture on our module Principles of Exercise Therapy, or you will know it as PET. The first lecture is about exercise driving an integrated system of systems. That's me, Dale Walker. You can reach me on Twitter at DJWalker587. So welcome to the module, and let me tell you what the module is all about. It's really recognizing that exercise is involved in all forms of physiotherapy treatment. It is our most evidence-based treatment, and it's probably the most effective treatment that we have. You, as a physiotherapy student, need to become a champion for exercise. That means that you believe in exercise, you believe in the benefits, and also you practice exercise yourself. So PET is broken down into various ways that we teach you. Obviously, you'll get lectures from me. You'll get tutorials from myself and the other tutors. There'll be practical sessions where you'll need your sports kit, trainers, so on and so forth. And there'll be online activities in the directed study. So, module learning aims. Really, it's about you developing this theoretical knowledge of exercise prescription and then having the practical skills to go with it. It's no good just theorizing about it if you can't actually do it. You've got to understand the principles of exercise therapy. So there are basic principles that we have out there. We're not giving you recipes, we're giving you the principles from which you will then learn to prescribe exercise. And these will be related to task-specific fitness or functional fitness. And we have to understand that exercise is integral to all aspects of physiotherapy treatment. Musculoskeletal, obviously, neuro, cardiorespiratory, burns and plastics, amputees, pediatrics, geriatrics, everything involves exercise. So our learning objectives are to get you to describe the structure and the function of the cardiorespiratory, the neuromusculoskeletal, and all the other systems that relate to exercise and physical activity. We want you to describe the immediate and the long-term or chronic adaptations to exercise and physical training, the prevent and provoke, as we call them. Eventually, by the end of the module, you will prescribe exercise, you will plan an exercise regime, you will implement it, and you will evaluate whether you gave the appropriate exercise or not, and you will need to see whether you've been effective in your exercise prescription. We want you to demonstrate effective communication, particularly with regard to instructing safely and correctly. Remember that the exercises are always done wrong, so they will need correction, and they need to feel that both tangibly and kinesthetically, as well as conjuring up the right image in their mind. You need to identify health and safety principles in all of your physiotherapy training, but particularly with regard to the exercise environment. We want you to identify current guidelines, either by the World Health Organization or by NICE, about healthy lifestyle, including nutrition, fitness, and physical activity. So the first semester is divided like so. The first lecture, exercise driving a system of systems. Then we cover the components of fitness, of which there are 10. Then we understand how the mind is related to movement. Then we understand how the mind is related to muscle. And then we travel from muscles and hypertrophy, that's muscular adaptation, the muscle growing bigger, to the heart, obviously the heart being the most important muscle. And then we travel to hormones, which regulate the body's homeostatic system. We cover biomechanics, the needs analysis of the patient, good posture, and how good movement comes from good posture. We cover range of movement and exercise communication and feedback. Then semester 2 we'll do functional strength and conditioning, exercise and outcome measures, exercise screening, and then eventually at the end, exercise prescription, prescribing exercise, giving the patient the right dosage. You'll be teaching and designing group exercise. So that's exercise for a big group of people, such as cardiac rehab. We're then covering things like balance and proprioception, cardiac rehab, and hydro or aquatic therapy. So as a physiotherapy student, you need to have the following skills: anatomy, clinical reasoning, communication, empathy, physiology, pathology, health promotion, human movement analysis, skill acquisition, evidence-based practice, treatment modalities, and in this module, exercise prescription and planning. So our expectations of you, we need you to sign the register or you will be counted as not attending. Please complete the directed study before the class. It's no good coming into the class expecting to know stuff when we've given you the directed study. So that's I'm going to wag my finger and make sure you do that. Sports clothes for all practicals, please. No bare feet unless we specify. Always bring some trainers, and use the sessions to ask questions. There's no such thing as a stupid question. Because if you think it's unclear, chances are somebody else is thinking it's unclear as well. And if you're struggling, speak to us so we can sort it out. So physiotherapy is a profession. It's a healthcare profession concerned with human anatomy and physiology, human movement and function, maximizing wellness and our human potential, and minimizing disease and injury. Ultimately, it's about solving real-world problems, of which we have physical inactivity being the fourth leading cause of preventable death after high blood pressure, tobacco use, and high glucose. So we've got these real-world problems. These are public health considerations. So we've got coronary heart disease, cancer, cirrhosis of the liver, chronic obstructive pulmonary disease, type 2 diabetes, depression, dementia, stroke, hypertension, and kidney disease. And all of these can be reduced simply by moving more. So physical inactivity affects the whole body: the lungs, skin, muscles and joints, heart, stomach, bones and other organs. It's a system of systems. Then we've got exercise. And exercise is going to increase your self-esteem, it's going to increase your energy, it's going to make your bones and joints stronger, it's going to control your weight and your metabolism, it's going to make your heart healthier, which will reduce your blood pressure, strengthen your immune system, improve your self-image, tone your muscles, and relieve stress. So exercise drives this system of systems. The mind drives the muscular system. The muscular system drives the cardiorespiratory system. The cardiorespiratory system drives the blood system. The blood system drives the neuroendocrine system. And the neuroendocrine system drives the hormonal system. Okay, so when you see things like this in the future, that might bamboozle you at the moment, but by the end of the course, you'll be fine and you'll know exactly what that means. So our definition of exercise therapy is using voluntary muscle activity produced by an integration of higher centers, cardiovascular, pulmonary, and neuromuscular components to rehabilitate these systems in the amazing Tidy's physiotherapy. So exercise is a subset of physical activity, and physical activity considered as bodily movements that enhance physical fitness and overall wellness. And you can remember that exercise is repetitive, planned, purposeful, and structured, and use the acronym REPS to help you remember this. Remember that exercise is about improving health, maintaining fitness, and can be used as a means of physical rehabilitation. So 3 levels of exercise: therapeutic, recreational, and competitive. The World Health Organization classifies types of impairment, activity and participation, and how these might be affected according to somebody's disability. It's important that we understand that, because we are prescribing exercise to people with impairments. So exercise, again, affecting the whole body, a system of systems. It's important that you understand that. The whole person, the holistic approach. There are 5 areas to consider. You've got the mental side, the emotional side, the physiological side, the behavioral side, and the spiritual side. But unless you change behavior, nothing changes. Okay, so physical activity guidelines. we have a daily target of 22 minutes per day. If we do that 7 times a week, that ends up in 154 minutes, and our weekly target is over 150 minutes of physical activity. So if we break that down, you've got 24 hours in a day, 22 minutes of activity, so 23 hours and 38 minutes of inactivity. Is that really too much to ask? 22 minutes is a minimum investment. So exercise prescription is a high-level skill that requires you to deliver the optimal exercise for the appropriate patient with an accurate dosage and correct technique. Remember that we're giving you exercise principles, not recipes, and you're going to have to think clinically about these. In order to help you remember the principles, we've given you the acronym ASPORT Billy, and we'll go through this now. Remember this. If you remember nothing about PET, just remember this. A is for adaptation. S is for specificity. P is for progressions or regressions. O is for overload. R is for reversibility. T is for time out. B is for behavioral change. I, individuality. L, lifestyle integration. L, law of diminishing returns. And Y, your responsibility. Learn this slide. It is the most important slide in PET. Remember that we're training movements, not muscles. The brain thinks in terms of functional movement, not isolated anatomy. Remember that physios are not 1980s bodybuilders. So the assessment, there's 2 ways that we will assess you. The computer-assisted assessment, which is a 45-minute computer exam, and then you've got a half-hour practical assessment, which is a Viva, where you could get individual exercise prescription or group exercise teaching. Your module team are myself, Dale Walker. You've got the undergraduate lead, Linda Hollingworth, David Dean, and Mike Dean. Remember, exercise is important. It does all these wonderful things. So you've got to navigate your way around Blackboard. The module schedule is in module information. Directed study is to be completed each week before the session. And then you've also got further reading to be done after the session to reinforce that learning. The session material will consist of the lecture by myself and then either a practical or a tutorial, and there'll be worksheets for this. If you're super keen, you can read the supplementary information, and I thoroughly recommend you do so. So by the end of this lecture, we have explained that exercise drives an integrated system of systems. You can appreciate that lack of physical activity is a major public health issue that concerns all physiotherapy professionals, and we're able to recall the principles of exercise therapy in the acronym ASPORT Billy. Thanks for listening, and I look forward to seeing you on the next session.